Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County, doing another COVID conversations today for June 20th, Juneteenth. And today we're going to be talking about COVID and special presentation about pediatric vaccines. Because in this last week, they've approved 2 vaccines for kids 6 months to 5 years of age. And we want to talk about those today and what they mean for you, your kids, and your grandkids maybe. So in the world of COVID, things are pretty quiet. The number of cases is at a level that is a little higher than it's been in the past, but really not increasing or decreasing almost anywhere in the world. So right now, we're seeing a little bit of disease still in Australia and New Zealand, although they're having a very low death rate and a very low hospitalization rate because most of the people have been immunized. We're still seeing some disease in Taiwan. Now, we don't know what's happening in China. So mainland China, they said they had an outbreak 5 weeks ago, and that has now passed, and they're having very little disease. But I think we have to take that all with a grain of salt. To suggest that they were able to control this just with public health measures seems to me to be rather extraordinary. So at some point, we may find out the answer, but for right now, I'm not sure. We're seeing not very much disease in Africa, which is a good thing, but we are starting to see a bit of an increase in disease in South America. So South America now is at the depths of their winter as we're hitting the depths of our summer or the heights of our summer. And so this is a little worrisome because it suggests that when the weather cools in the fall that we might see another surge. But right now, the world is pretty quiet. We always carefully follow the United Kingdom because they have seemed during this entire pandemic to be about 8 weeks ahead of the US. So what happens in the UK, 8 weeks later happens in the US. So they had an Alpha surge, a Delta surge, an Omicron surge, little BA2 surge. And each of those times, 8 weeks later, we had that same kind of surge in the US. So I always look at them basically every day to see what's happening there. And they're very quiet. So they're not having a lot of disease in the UK, which would suggest that in 8 weeks, we would also expect to have very little disease. When we look at the strains that are circulating in the world, it's mostly BA2. There's still some BA4 and BA5 circulating around, but they've not really taken off like we feared they might. So it's mostly BA2, some BA4, BA5. In the US, we're kind of flat. Places that had this early, like New England, are now quieter. We're still seeing a fair amount of disease in southern Florida, Puerto Rico, and Hawaii, but the rest of the country is pretty quiet. And Oregon is also kind of flat, a flat number of cases over the last 3 weeks. The number of hospitalizations in Oregon is now down a little bit, and the number of people in the hospital, in the ICU, or on ventilators is very low. About the lowest it's been since the beginning of the pandemic. So this is all good news. When we look at the strains that are circulating in Oregon, again, it's mostly the BA2. In Douglas County, we're seeing a moderate number of cases, about 30 or 40 a day, which is a moderately high number for us, but many of the people getting it are not particularly ill. We're not seeing a lot of people in the hospital. We only have 5 to 10 people in the hospital over the last week. Again, most of the people in the hospital are not up to date on their vaccines. And that's going to be important as we talk a little bit about vaccines later. We have had a couple of deaths, but again, really down from where we were during Delta and early on with Omicron. Again, the vaccine seems to be effective, as well as the Paxlovid, which is an oral pill that you can take after diagnosis, also seems to be effective in reducing the risk of hospitalization. And so that's good news. On the vaccine still seems to work. So going back to the vaccine was made from the very original strain that was around in January of 2020 that we call the ancestral strain. And over time, this virus has undergone many mutations. You remember first in the summer of 2020, there was the B614G mutation. Then there was the alpha, the beta, the gamma, the delta, and then the Omicron variants. And each of those changed the capsule a little bit. And so it doesn't radically change. It's still a coronavirus, but it changes it a little bit. And so the vaccines were made against the ancestral form, and the antibodies we make against the ancestral form, and they work great against the ancestral form, better than 95 or 96% effective. A little less effective against alpha, a little less effective against delta, and a little less effective against Omicron, because again, the virus is a little different, and our antibodies, which are directed against the ancestral strain, work great against the ancestral strain, but a little less well against the subsequent changes. So what we're seeing now is we're seeing people who are vaccinated are getting the disease. So we're seeing a fair number of breakthrough cases, although they tend only to be mildly ill. And if they're older or sicker, they're all getting the Paxlovid, and they're not winding up in the hospital. In this last week, Dr. Fauci from the National Institute of Allergy and Infectious Disease, who's been kind of the face of this pandemic, got it, but he's been vaccinated and boosted and had a very mild case. The vice president also had a very mild case in the last month. And again, if you're vaccinated and boosted and have access to the Paxlovid, we could probably expect very few hospitalizations and very few deaths. So the vaccine is great. It was much better against the ancestral strains than it is against these strains, but it's still useful. So a couple of vaccine questions. One is, are we going to have a booster against Omicron? And in the last week, there's been some stories that we will come up with a booster that'll be available this fall that will have both the ancestral strain and the Omicron strain, and that when you get this, you'll get protection against both. So we'll see how that works and whether that comes to fruition. Unfortunately, during this pandemic, much of what we've heard is from the CEOs of companies rather than the research scientists. So when the CEOs say things, I always take them with a bit of a grain of salt. And so the big question now is about the pediatric vaccines. So we've been working on the pediatric vaccines for a while. These pediatric vaccines have the same ancestral strain as the adult, and they have the same RNA technology as the adult, but they're in smaller doses. So there's one by Pfizer and one by Moderna, and they have anywhere between a quarter and a tenth of the dose. And they're given in a series of 2 or 3 shots, depending on when you get the Pfizer or Moderna. And they both seem to be quite effective in preventing infection, even with Omicron. So the question is, when you give vaccines, you're always looking at the risk and the benefit. So the question is, what's the benefit of this vaccine, and then what's the risk? Well, the benefits of these vaccines is your kids not being sick is always a good thing. We know that when kids get sick with COVID, that a lot of them seem to get this long COVID. And so you may know I'm a pediatrician and I'm working in the clinic 2 days a week. And I will tell you, almost every day we see a kid with long COVID. These are kids who had COVID weeks or months ago, and they got COVID. And then since then, they've been not quite right. Troubles breathing, shortness of breath, recurrent pain, either not sleeping well or sleeping too much. And so this really does seem to be related to that infection. It is really, really problematic for the families who have that. In addition, we've not seen any cases here, but throughout the country, there have been cases of this MISC, M-I-S-C, which is this multi-inflammatory system condition in children. And it's bad. When the kids get it, they have high fevers, they're really sick. Many of them wind up in the ICU, and some of them have died. And we think this would be prevented with the vaccine. Now, we worry with the vaccine because of some rare case of myocarditis that was seen in teenagers and young adults, especially men, who got the vaccines. The good news is there have been no cases of myocarditis with the kids, so that's a good sign. So the benefits are reducing the risk of severe disease, which is not common in kids, reducing the risk of long COVID, which is common, not super serious, but pretty worrisome, and then reducing the risk of MIS-C, which is rare but really serious if you have it. And then the question is, what are the risks? Well, they did pretty good safety studies, and the pretty good safety studies suggest that this really is a very safe vaccine. So when you weigh the risks and the benefits, I think the benefits clearly outweigh the risks. and I would recommend that kids from 6 months to 4-year-olds get the vaccine. I have 3 granddaughters in that age group, and I would 2 granddaughters and a grandson in that age group, and I would recommend that each of them get that vaccine as soon as it's available. And we think it's going to be delivered today and available as early as Wednesday of this week. So if you're looking to get that vaccine, talk to your provider. People have asked, well, would you prefer one over the other? There's differences. The Moderna is a little higher dose, but you only need 2 doses. The Pfizer is a lower dose, but you need 3 doses. So they give about equal protection. So I think I would get whatever your doctor has. We're going to have both of these here in the community, but I think doctors will choose to have one or the other, just because of the complications of storing vaccine. The other vaccine news that's out this week is that the Novavax vaccine has also been approved. So Novavax is a vaccine which is a protein-based vaccine, and it was made in the old-fashioned way, where you basically make a surface protein, and then you sterilize that, inject that into people, and then people make an antibody against that surface protein. It's an older technology. It's what we use, for example, with hepatitis B. Very successful, really very safe. The problem is it's really slow. I mean, had we waited for protein-based vaccines and not gone with the RNA vaccines, we would just be getting our first doses now, and who knows how many more deaths we would have had along the way. The other problem with Novavax is it's being produced in very small amounts, so we're not going to be able to get our hands on any for a while. But there may be that occasional person who just is really leery about the RNA vaccines who might want to go ahead and get the protein-based vaccine. I have a friend who's said they're not going to get the vaccine until this protein-based vaccine gets out. So as soon as it's here, I'll give him a call and tell him he can go ahead and get his vaccine now. So overall, things with COVID are pretty good. We are having a steady number of cases. We expect the number of cases to stay low for a while. We expect to have a very low number of cases this summer, but still some people are going to get sick and some people are going to be really sick. So we do recommend people get vaccinated anywhere from 6 months to forever. And that we do recommend that for people at high risk, if you do have COVID, to talk to your doctor about getting one of the antiviral medicines, such as Paxlovid. Again, this is Dr. Bob Dannenhoffer, the Public Health Office of Douglas County. If you have questions, please send them to us at Facebook questions at douglaspublichealthnetwork.org, and we'll get to those next week. Bye-bye.